Thanks for the introduction from Dr. Tian. And as he mentioned, the first talk after the lunch break can be hard for you to pay attention. So I hope the images I'm going to show you will excite you and keep you excited. So the topic I'm going to talk about is the real-time imaging at 0.55 Tesla. So here at the Dynamic Science Center, we have built up we have installed a 0.55 scanner equipment with a high-performance gradient, and that system has been up and running for almost a year. So in this talk, I'm going to give an update of the effort we have been spending on doing real-time imaging. So the first question to ask ourselves is why we are interested in looking at in doing real-time imaging. So the answers are twofold. So first of all, many organs of our human bodies are in constant motion, such as the respiratory system or the heart. So these systems are in constantly moving in order to keep us alive. The traditional way of doing imaging around, such as the lung or the heart, is trying to freeze the motion over there. So, but there's a lot of difficulties. For example, patients with cardiac conditions, they may have trouble holding their breath for a period of time, or they can have arrhythmias, which preventing us from getting a stable ECG signal to get the scan. So a more improved way of scanning such organs is by using the real-time imaging techniques. So instead of freezing the motion, we can capture the motion in real time and reconstruct real-time images to evaluate the health conditions in the lung and the heart. So the second reason we are interested in doing real-time MRI is a lot of the organs of human body are designed to move. So in order to get any clinical information from these organs, we have to ask the subjects to perform some voluntary maneuvers in order to evaluate the conditions over there, such as this example shown here, the speech or the wrist movement or during the swallowing. A lot of these movements are not repeatable. So the traditional way of doing segmented accreditation is not possible. So this is also where the real-time MRI plays a very important role in doing evaluating these organs. So there's a historical trend of going to higher field strengths and higher gradient performance in the MRI community. So as you have heard some very successful stories from this morning, that we have been very successful in our ultra high field strengths in doing static imaging, such as in the brain. But the general trend of going to higher field strengths may not benefit for all the imaging modalities, such as imaging the in a dynamic environment, or may not benefit for real-time imaging. So in recent years, a lot of the researchers start to notice that there might be an opportunity at this corner to go from higher field strengths to lower field strengths, but equipment these low field scanners with the highest possible gradient systems. So there is quite a lot of technical benefit by using these high performance low field systems. So if we go from a higher field strength to a lower field strength, there is a greatly reduced heating issues. And since the field strength is lower, so it is relatively easier to maintain homogeneous B0 regions. And also a lot of the factors affecting B0 homogeneity is greatly reduced at a lower field strength. Also, once we equipment this low field scanner with high performance gradients, we are allowed to do faster imaging encoding. And also with the modern design of the gradient system, the gradient linearity area is greatly enlarged, which allow us to do large FOV imaging. So in the next part, I'm going to start with these technical advantages and introduce some effort we have been doing to improve the real-time imaging capability at our high-performance low-field systems. So the first technical advantages, if go from high field strength to low field strength, we can think about is the SAR reduction. So the SAR is short for specific absorption rate, which is a time integral over a lot of characters. But the one we are mostly interested is this omega term, which is the resonance frequency, which is proportional to the Bezier field strength. So as you can imagine, if we go from a traditional 3 Tesla or 1.5 Tesla scanner to a 0.55 Tesla, there's a great amount of SAR reduction. So for example, from 1.5 Tesla to 0.55, there's about 7.4 times reduction. And comparing the SAR between 3 Tesla and 0.55 Tesla is about 13 times reduction in the SAR. So here I'm showing an example of what is made possible by the greatly reduced SAR at the high performance low field system. So the example shown here is a series of real-time cardiac images acquired with very high flip angles, but with a relatively shorter TR. And these images were acquired with a real-time spiral with a TR of around 6 milliseconds, and we achieved a very high temporal resolution at 77 milliseconds per frame. And also the benefit of going to a higher flip angle is very clear, shown by this series of images. As you can see, you go to a higher flip angle, the contrast between the myocardium and the blood pool is greatly increased, which can provide a better quality images to estimation for example, the ejection fraction or regional left ventricle wall movement. So the previous example showing a single slice example of the high flip angle real-time cardiac imaging. And what is more amazing is that the high performance low field system may potentially support contrast optimal simultaneous multi-slice BSSP imaging for cardiac function assessment. So the simultaneous multi-slice technique is an imaging acceleration technique that can simultaneously excite multiple slices and acquire the data at the same time. But this technique comes also with a cost, which is the increased SAR issue. As you go up higher in the SMS factors, the SAR is also largely increased. So this is preventing the use of very high flip angle for BSSP imaging at, for example, 1.5 or 3 Tesla scanners. So a study have suggested that the contrast optimal flip angle at 1.5 Tesla should be around 105 degrees. But this is only possible for doing single slice imaging and cannot benefit from the great acceleration technique of SMS. But this is totally possible at high performance low field systems because the SAR is greatly reduced, which allow us to combine the single slice RF, but with not over the limit of the SAR. And in this study, we have experimentally determined the contrast optimal flip angle for cardiac CNA examinations, which is around 120 degrees. And this series of images were acquired with this optimized flip angle with a relatively shorter TR. And all of these images with different SMS factors shows great quality. So the next technical advantages is obviously the reduced off-resonance. So going from a higher field strength to lower field strength, the susceptibility related off-resonance is largely reduced, especially at the tissue boundaries, such as between the air and tissue or the fat and the water. So this example images compares speech image acquired at 1.5 Tesla and its associated field map, and also a series of image also speech images acquired at 0.55 Tesla. Maybe you cannot see clearly how much the off-randomness frequency is reduced because this, if I put the images on the same color scale, this will be very smooth. But I can tell you it's about 3 times reduction in the off-randomness frequency. So what this made possible is we are given the opportunity to pursue for BSSP imaging for speech, for real-time speech. So here's a comparison between real-time speech imaging acquired at 0.55 Tesla with a BSSP sequence and real-time speech image acquired on 1.5 Tesla with a GRE contrast. So you can clearly see that the images acquired at 0.55 Tesla is way sharper in some of the speech articulators, such as the worm or the tongue tip or the lips. So these images were acquired with relatively similar parameters, but you can appreciate the sharpness of this 0.55 Tesla images. So when talking about real-time MRI speech imaging, so here at USC, we have built up a very successful real-time imaging system for doing real-time speech over the past few years. But the system was built associated with a 1.5 Tesla scanners. So with the recent coming 0.55 Tesla scanner, we have also migrated the entire system from 1.5 to 0.55 Tesla. So this is a quite complicated imaging system, but to be short, the real-time speech MRI system roughly includes 2 parts. One is the audio system and the other is the imaging system. So for the audio system, we want to record some speech from the subject. So there's a need to let the subject to read something. So we have a projector sitting in the console room, and this projector can project a sentence or some words into the screen inside the scanner's room, and the subject can read from this screen through a mirror reflected to the eye. And also associated with this projector is the audio record system. So we have a microphone that is put very close to the subject's mouth here inside the board. And we have another microphone not shown on this picture, but is receiving the acoustic noise from the gradient. So with these 2 microphones and the audio recording computer, we can do post-processing to reduce the acoustic noise coming from the gradient. Also for the imaging system, we have built up a speech coil. And the speech coil is very flexible, and the coil elements can be adjusted to be very close to the region of interest, which will greatly improve the SNR when compared with Siemens, the head and neck channel. And a detailed evaluation of this speech coil will be presented at this year's ASMRM. And for the imaging part, we use a real-time interaction and control system called Artichoke to control the scan and receive the data. So by incorporating this great real-time speech MRI, what we can do is to synchronize real-time MRI images with the recorded audio. And here's just an example of the result from this system, and it was just acquired a few days ago.
He transcended the divide by spotlighting what average Americans need.
So with the this real-time imaging system, which greatly enriched the linguistic studies and also have some clinical usage, such as post-surgery recovery. So another imaging modality that is made possible by the reduced off-randomness is using real-time MRI for studying the lung. So to greatly reduce the off-redness artifacts can allow us to image the lung with great details, as shown in this series of images. So we can see that the lung arteries are clearly depicted by the real-time sequences. And by having this detailed structure, the automatic algorithm can use these tiny structures as landmarks to guide the image registration. And from this image registration, we can quantify for the regional lung movement and further evaluate the regional lung functions. Also, because we have the greatly improved ability to doing BSSP imaging, we are also pushing the limit of using a longer readout plus the BSLP contrast. So here's an example of doing the wrist imaging by using the long readout real-time BSLP. So because of the greatly reduced off-redness, the binding artifacts will not appear on the 0.55 Tesla compared to the binding artifacts preventing we visualize these structures at 3 Tesla. So you can see the SI interval is clearly depicted on the static image as well as all these high resolution real-time images. And amazing spatial resolution was achieved. This example showing 0.94 in-plane resolution, and this is showing a 0.74 in-plane resolution real-time images. So Dr. Adrian has presented some of the work by using a spiral in and out sequence to improve the SNR efficiency for cardiac signal examinations. And this collaboration work between the NIH group and the University of Virginia group has put this spiral in and out sequence into real time. Note that the TR is not surprisingly high because now the limiting factor is not because of the binding artifacts, but because of the flow artifact that is very common in cardiac examinations. But combining this real-time spiral in and out sequence plus the low rank and sparsity reconstruction, they have achieved free breathing real-time spiral cardiac images with great quality, which is comparable with the traditional breath-held Cartesian signals. And also another possibility is enabled by using the long readout and BSLP image contrast is shown here. So we have implemented a spiral out-in sequence, which allow us to capture 4 images within each TR. And the 4 images are at 3 different echoes. And from these 4 images at 3 different echoes, we can do water-fat separation as showing on the right. So on the upper part is a cardiac example, and on the lower part is a wrist example. So on the fat-only image, you can see clearly the epicardial fat. And even though there is a binding artifact moving up and down with the real-time breathing, but this is totally out of the area of interest and not affecting visualization of the myocardium. And on the wrist image, the improved contrast at the fat-only image really provide a clear depiction of the SI interval. So another possibilities we are exploring is the fetal imaging. So because of the greatly reduced heating issues, this is considered to be safer for the unborn babies. And also because of the reduced acoustic noise, the fetus can stay relatively still during the entire scan. And also for some certain patient groups, such as pregnant moms with a larger body size, we have a 70 centimeter bore, and with the newer Freemax scanner, it has a bore size of 18 centimeter, and this large bore size can fit the need for all the body sizes. And these 2 examples shown here are recent real-time spiral images again acquired with a very high in-plane spatial resolution. And if you look closely enough, you will notice some interesting structures like the two-chamber heart in some moments, and the brain of the fetus is also clearly seen here, and also a four-chamber heart in another view. So I have talked about a lot of the amazing techniques made available by the high-performance low-field systems, but there's also quite a lot unmet need and challenges in terms of the doing real-time MRI. So a very unique requirement is to have the ability of doing low latency reconstruction. This is very important for some specific studies, such as the speech or the cardiac intervention. So in this work, led by Prakash Kumar, we have implemented a self-calibrated through-time spiral grappa and to achieve real-time image reconstructions. So with a naive implementation of this algorithm, we have achieved 25 latency at a temporal resolution of 30 milliseconds. We believe that with optimized image reconstruction algorithm and computational power, we totally able to achieve online reconstruction of such high quality and high temporal resolution images. So the group at University of Michigan is looking at clever ways to use the networks to reconstruct the images. So this work presented here uses two networks to learn the spatial and the temporal basis functions from the data. So the network do not directly reconstruct the images, but the networks reconstruct the spatial and temporal basis functions. And then from there, the real-time images can be recovered from these basis functions. So the amazing part of this study is there's no need for fully sampled training data, and the training can be done with only one undersampled data set. So the example shown here is a result of only collecting 7 seconds of data per slice. So another major challenge coming together with going to lower field is the concomitant field. So the concomitant field is roughly proportional to 1 over the B0 field strength. As you can imagine, if we go from a higher field strength to lower field strength, the concomitant field will largely increase. Also, the concomitant field is related to the distance from the imaging location to the isocenter. As you go further away from the imaging isocenter, such as applications that require large FOV, you will see more concomitant field effects. And also another challenge of doing large FOV imaging is the gradient nonlinearity, as can be seen of this example image. So this part is largely distorted, which preventing a precise quantification. Nam Li from our group is leading a series of studies by applying the model-based reconstruction to resolve all these image artifacts. So the max curve is recently accepted by MRM is looking into using the curve predicted waveforms to correct for the concomitant field and off-redness effects. So the benefit of using a gradient impulse function corrected waveform is they can predict the concomitant field at a higher accuracy than using the nominal gradient waveforms. And also, in a recent effort, he is incorporating the high order reconstruction into the reconstruction framework to correct for the gradient nonlinearity issues. Also, a new possibility is to combine all of this to provide a solution for off-redness, concomitant field, and gradient nonlinearity. So as a summary, the high-performance low-field systems has a lot of technical advantages, such as reduced SAR, improved B0 homogeneity, and faster encoding, which allows a lot of the real-time imaging applications to be improved at such systems. Also, there's quite a lot of challenges such as we need to reconstruct images at a very low SNR environment, and some I might need. And also there's also quite a lot new possibilities at these systems. So with all that, I would like to thank our funding and support and collaborators, the slide contributors, and our lab members.